What can we do to turn the curve towards less people dying by suicide moving forward? Prevention efforts to decrease suicide risk in the first place can be strengthened to increase protective factors, including promoting positive mental health and emotional well-being across our communities. This can be best accomplished through efforts to move from fragmented prevention efforts to a more comprehensive statewide approach. This is the essence of a public health approach, which looks at many factors and brings together schools, healthcare systems, emergency services, businesses, faith-based communities, and other groups and individuals to tackle this problem holistically.
Vermont is consistently ranked one of the most healthiest states in the nation, often number one. And yet our suicide rates are worse than average. We consistently have been increasing our suicide rates. And if you compare us to the rest of the states, we're not even close to the top in terms of suicide prevention. And I think the Department of Mental Health feels that this needs to be a priority. So our goal for this year, we have put forward some priorities for suicide prevention that are found in S69, a bill going through the legislature. And some of the things we know we need to do are great access and quality care for anyone experiencing suicidal ideation, thoughts, or intent. And that can look like whether or not you want to speak to a peer through the Pathways support line, or if you're maybe more into texting, we have options for 24/7 text lines through 741-741, as well as supporting the upcoming 988. That's the Suicide Prevention Lifeline. It's a free and confidential 24/7 line to support those experiencing suicidality. In addition, we're looking to have a position who can dedicate full time to this issue as a suicide prevention lead for the state. And we do feel like that's going to be incredibly important to have someone who can coordinate all of the great work that's going on. We know we can have some of the best quality care in the state. We have the right people, and we just need the right resources.
Today, I wanted to highlight in particular the barriers to access caused by the workforce crisis at designated specialized service agencies. The first time ever in the 25 years I've been in this job, I have directors and program folks expressing concern about the health and safety of the people we serve. It's a lot of responsibility to provide that level of support, and it's hard. We're in a hard place. We have many adults in Vermont waiting for outpatient services. There's 360 waiting for a specific outpatient service, and that wait is usually over a month. Our children and youth have 523 people or children and youth waiting for outpatient services. Those waits, the average is 107 days. That's a long time to go without a service that you really need. People are in crisis and they're seeking help.
Means matters when it comes to suicide. You can look at the causes of suicide, and this is in Vermont from the Vermont Department of Health. About 57% of suicide was caused by guns. Here are some ways that you can be supportive of preventing gun suicides in Vermont. Obviously, we just had S30, which hopefully will be coming back to us soon, and we'll go back to the governor soon. But other things that you can be doing that we can do legislatively are financial incentives to purchase gun locks and safe. Provide resources to schools, social services, social service centers, and VAs, and any other place. Purchase waiting period is also something that would be helpful in terms of reducing gun suicides in the state. You'll probably hear this from other speakers today. One of the most crucial things you can give somebody who is considering suicide is time. The more time you can give them, the more time there is for intervention.
So why are we so concerned about safe storage? How prevalent is unsafe storage? Well, we know that 43% of all Vermont households have a firearm. We know that 17% of those do not keep them by self-report safely stored. And many of those also keep them unlocked. So if you do the math and you break out that 43% into subgroups, you wind up with about 13,000 Vermont houses or households have, I would say, improperly or unsafely stored firearms. That's a pretty big number. And we already know that Vermont has a pretty high rate of child firearm suicide deaths. So this is really getting back to that public health strategy. If we can get those firearms stored more safely, more securely, we may be able to have an impact on these highly lethal, highly impulsive suicide attempts.
The Lifeline, for short, provides free, confidential, 24/7 support to anybody in suicidal crisis or any kind of emotional distress. They're impacting either call center's ability to answer are things, I would say busy signals, but nobody ever gets a busy signal. Their call is just routed to another signal. But if we're already on the phone, we physically can't answer. Both call centers are in the process of trying to add an additional line, but that also means additional staffing to be able to answer those calls. There's quite a push also with the National Lifeline to begin offering a lot more follow-up services. And this is kind of a whole new twist on things. So callers that are expressing current or any imminent suicidal crisis, they're being asked if they want a follow-up call from the call center. So the call center would call them and initiate that call. Continue to sort of do what we can to meet the growing demands as 988 begins to roll out more and more, and the publicity of that. We know call volume will increase significantly, and Vermont's 2 call centers will continue to do everything we can to try to adjust and meet that demand. However, it certainly will take additional funding to sort of keep that safety net going.
To you as legislators and advocates wondering what you can do, I think first of all that you're here today. It shows that you do care, that you're recognizing the need and want to learn more about it. We have tools, we know best practices, we have a great coalition, we have great leadership at the department. So we have potential to address this problem and hope that you can support those efforts.